For people with severe obesity who've tried everything to lose weight, bariatric surgery can be life-changing. But this weight loss procedure comes with a hidden risk that some doctors don't talk about: transfer addiction. This happens when patients trade their food addiction for another compulsive behavior, like alcohol, drugs, or gambling. Reporter Kristen Crowley uncovers why some in the medical field are hesitant to talk about this risk and speaks with patients working to bring awareness to it.
Sisters often share a special bond.
She was funny, she was charismatic.
That was certainly true for Amanda and Carrie, who not only considered themselves best friends, they also lived next door to each other and traveled the world together.
Hawaii for her 40th birthday. We went to like Key West in Mexico. We did a med cruise out of Rome to like four Greek Isle stops.
But for Amanda, the most impactful journey was one she never expected: Carrie's weight loss journey after bariatric surgery.
I saw how happy she was and how she was coming out of her shell. She was being more social.
So the surgery seemed successful.
Yeah, totally successful.
Did exactly what it was intended to do.
Yeah.
But it came with an unintended consequence.
At some point after about 2 years, I started noticing her drinking more, or the drinking, her just being 2 drinks and so incredibly drunk.
Your sister's drinking habits before the surgery. How often was she consuming alcohol?
6 times or less a year.
She was not an alcoholic.
No.
After surgery, it was a different story. Amanda says Carrie drank regularly. She believes it was all related to a little-known potential side effect called transfer addiction. The Obesity Action Coalition says transfer addiction happens when patients with compulsive eating habits swap food for other things like alcohol, drugs, gambling, sex, even shopping. It says studies show as many as 30% of bariatric surgery patients experience it. Dr. Ann Rogers is president of the American Society for Metabolic and Bariatric Surgery, which works with MBS AQIP. Dr. Rogers says one reason transfer addiction isn't mandatory to teach is there's not enough research to show it even exists.
It's very hard to study in humans. We don't even know if there's such a thing as food addiction per se. So while you can go without cigarettes or alcohol, you can't go without food. So we can't study what it's like to have people quit eating cold turkey. So that just makes it impossible to study it as a form of addiction.
But the effects of alcohol on people post-weight loss surgery are well known.
You very quickly can get intoxicated as well as dehydrated and malnourished. So we do say, after surgery, we strongly encourage no alcohol use for 12 to 24 months at all.
Dr. Jessica Hamilton is a clinical psychologist who evaluates patients before weight loss surgery. While she doesn't specifically talk to patients about transfer addiction, she does talk to them about the risk of alcohol use disorder.
Was this the last trip you took?
Amanda says she tried desperately to get her sister help.
How many times did she go to rehab?
1, 2, 4.
Carrie was about to go back to rehab for a 5th time when she was found unresponsive on her kitchen floor. She died in November of 2018. The cause of death: alcohol poisoning.
What do you think when you hear that it's not mandatory for doctors or surgeons to tell people about the possibility of transfer addiction?
I would tell them they can have my grief, and they can have my pain, and they can have my anger.
Wow, they can have my grief and pain.
Yeah,
Powerful.
Wasn't that powerful?
Very powerful. I think one of the biggest things, we're taught as physicians, do no harm. And just because something is not, that you can't prove it medically, if you've seen it several times, it is your obligation to just put it out there and say, you might want to look out. I've seen this. It doesn't mean that, it's going to happen, but you don't know what you don't know, and you can't look for something if you don't know about it.
Right.
I think it's foolish to think that you wouldn't trade one addiction for another. We all do.
We do it all the time.
We do it all the time. You might trade a bad addiction for a good one. Working out can be an addiction.
To me, if you go from one weight to another weight, if I think about myself, I would have significant emotional things to process, whether it goes to addiction or not. If I'd changed that significantly, if I got in a wreck and my face was damaged, I'd have to get counseling to say, these are feelings that I've had as a result of the accident.
But many people, when they have the surgery, that's what they're expecting. They're expecting the weight loss. But you know, they go through all these different psychological testing and all these different things. And just like she said, you can't prove addiction for food exists because you can't stop eating. However, people will tell you, I have food noise. I have food, it's talking
That's
to me.
right.
I gotta eat. I mean, that's what you see with these GLP-1s. It calms the food noise. So you don't have to take something away to say that the addiction is not there.
Of course, we're assuming that there would be a physician really involved to ask questions, and sometimes with the GLP-1s, there's not a lot of questions asked. You're dealing maybe with a nurse practitioner, long distance, and people just get started on them. And hopefully what they experience is just joy, but people should be aware that you might deal with some rather difficult things.